The UK military is struggling to replicate the work of ambulance staff, who are the next workers to walk off the job in England and Wales. The military were called in to cover for the striking workers, but say they cannot guarantee the safety of patients.
They are willing, they are able. But the military can't fully replicate the work of the ambulance staff, who are the next to walk out in England and Wales.
So this top button will be deploying, all right, so just be aware.
The plea from the NHS to the public is simple. Don't add to our burden.
Emergency ambulance, the patient breathe in.
Tomorrow is not a day to have an accident or to need urgent care.
If you think you need to go to hospital, then perhaps it would be a good idea this evening to ask a friend or a relative whether they would be able to take you to hospital should the need arise tomorrow.
The system is already straining. The queues in Stevenage are replicated already in so many hospitals around the country. There is a real nervousness within the health service as to how this plays out, just how many people will be left without the care that they need. It is an intensely difficult moment for the NHS, just at the point when they need their staff the most. Before their strike, paramedics in Yorkshire supported the nurses who were back out for a second time. At Leeds General Infirmary, this was the Christmas get-together nobody wanted. How much appetite do you have for doing this again in January, February?
Absolutely, all the way. Absolutely, we've got to.
The Royal College of Nursing say they have to be paid better. The Westminster Government say they can't pay better.
I believe now it's incumbent on the Prime Minister on the eve of Christmas to get behind these nursing staff and patients and do the decent thing, get into a room and start to talk to me.
Thank you. If I can introduce you to the care home manager, if I may.
The Health Secretary insists he wants to do it.
We're keen to talk, we're engaging with the trade unions. On pay, we have an independent process and we have accepted that in full. And of course, that comes on top of the extra prioritisation of the NHS.
I'm telling you why Barclay isn't coming to talk.
They all know that this is unsustainable. It really can't go on. But without a compromise, it will.